Neighbors of Hudson County. By now you may have all heard of the novel coronavirus. Why is it called novel? Well, because it is a new virus, which means there's not yet a cure, a treatment, or vaccine. We're constantly hearing about it all over the television, radio shows, Facebook, newspapers, and even TikTok. So, we're not here to share with you the same information that you're hearing everywhere else.
We understand these are frightening times for us all right now, which is why we from Chat North Hudson want to put out this special message of solidarity for you all. In these uncertain times, most, if not all of us, are living through our very first pandemic. And what is most scary is that we don't know how long this crisis will last or what implications it will have on our daily lives. This requires us to take a step back, breathe, and analyze the facts and separate that from our emotions.
By now you all have heard from health authorities about the necessary precautions one needs to take in order to prevent the spread of the virus. If you haven't heard by this point, you should know that this isn't the same as the flu virus or the H1N1, and that in fact, it is much more dangerous. This is why we can't stress enough how serious this should be taken.
This is not, however, a time to panic. This is a time to assess what we really need to do to survive, to help others who are most at risk, like the elderly and those with underlying health conditions, and to mitigate the challenges we're going to be facing as families, as a community, and as a nation. Just because you're of good health today does not mean that tomorrow that can't change. And in fact, the one thing that we're all going to realize is that we're only as strong as the weakest among us. And in the case of Americans, the least insured among us.
This will be a time of reflection, a time to evaluate what is working in our society and what is not working, what things we absolutely need for the common good, and what precautions we should have been taking, what things we were not prepared for in a pandemic as well. It's time to evaluate whether this me culture is really the kind of society that could survive a crisis like this, because this mentality certainly is going to be put to the test.
What this virus will teach us is how to reevaluate the way that we run our lives and who we take direction from. This virus benefits from us not slowing down. The reason other countries have been able to control the rate of infection is because they took drastic actions like a strict quarantining of the population. For example, in Taiwan, where they previously suffered a terrible SARS epidemic, they learned to rely on experience rather than waiting on global political leadership. Taiwan's population is about the size of the whole state of New York, and they've only had about 45 infections, whereas New York, there are about 600 and counting. In contrast, Italy and Iran seem to brush off this threat. Does that sound familiar? Neither did much testing, even as people began to show symptoms, nor did they show a sense of urgency in stopping mass gatherings. We are seeing the effects of that now. And in America, we're afraid of slowing down and paying the economic price of taking such drastic precautionary measures. Whereas other countries have closed down entirely, we're still figuring out ways to keep business open as usual, denying facts, denying the critical need for additional testing, and denying the scientific need for isolation.
It's a fact. As more infections spread, and they will spread fast, our healthcare systems will be put to the test, possibly stretched to their limits. Consider that we have 35 million people without health insurance in this country, and that's not including homeless or the thousands of immigrants currently in those crowded detention centers. As we've seen in other countries, like Italy, who are suffering this same crisis alongside us, the more people get infected, the more hospital visits and stays will be necessary, and we only have a limited amount of hospital beds. Our hospitals will reach capacity and doctors will have to start selecting which patients to treat and not treat. In fact, for reference, New York City has over 8 million residents and yet only about 3,000 emergency room hospital beds to service this enormous amount of people.
Yikes. And we know that about 80% of those infected will have mild symptoms and will likely recover. However, there's another 20% who will have severe life-threatening effects, and those are the ones that truly need this kind of urgent care. Now try to calculate in your head right now what 20% of 8 million people in New York City alone is. That's a lot of sick people.
So let's talk about what things we need to be doing as a community here in Hudson County to protect ourselves, per the CDC, because this is not just about you and your toilet paper. Number 1, stay informed. Make sure you follow reputable sources like the cdc.gov website. Sign up to their newsletter. Trust scientists, not politicians, to give you information critical to your health.
Number 2, be prepared to have enough household supplies and non-perishable food for each person in your household, including basic health supplies like pain relievers, cough and cold medicines, and fluids with electrolytes.
Number 3, we have to avoid crowds or large gatherings and avoid direct physical contact. The virus is airborne, so general social avoidance is what is being recommended. Stay home. Even being in the same space as a sick person can get you infected.
Number 4, communicate with your neighbors, particularly the elderly and those with underlying conditions. Get their phone numbers. Let them know that you're there to help, even if that means getting some of the same supplies for them. Localized community response is critical during times where federal, state, and local authorities are overwhelmed. If you have a smartphone, this is a great opportunity for you to download Nextdoor. It's a neighborhood social networking app. Now we'll provide a link in the description.
Number 5, if possible, provide a protected space for vulnerable household members. If you have a spare room in your home for them, prepare that space.
Number 6, create an emergency contact list of family, friends, neighbors, carpool, healthcare providers, teachers, employees, and local community resources. This is going to be your community phone tree.
Number 7, if you feel sick, stay at home and avoid public areas and public transportation. Call ahead before visiting your doctor or the hospital and wear a face mask when heading over. Do this before heading straight to the hospital, as you want to make sure a visit is absolutely necessary for your own safety and for the safety of those around you. If you cannot get a face mask, contact someone from your community phone tree who may have one that they can bring over. They can leave it in a bag on your door handle without making any physical contact with you.
Number 8, as always, call 911 if you have a medical emergency, but first notify them that you suspect you may have the coronavirus, and if possible, wear a face mask before they arrive.
And finally, go to joinsubtext.com/NJ-coronavirus and enter your phone number for live New Jersey alerts. We found this very helpful and are subscribed ourselves.
Remember, we are all in this together. Our survival is a collaborative effort, and the more that we cooperate, the slower this virus will spread.
We will get through this, as we have gotten through much adversity before. We will learn many lessons, and our society will change from this forever, most certainly for the better. Our understanding of hygiene will improve. We will finally set up a permanent framework to handle pandemics in the future, and we will learn the values of social solidarity. So stay positive, and remember, no matter what, we're in this together.